All right. Hello, Dr. Jen. Welcome to
No,
Mind Bloom.
thank you for having me.
How are you today?
I'm good. I'm good.
Yeah.
It's been a little crazy week, but I'm good.
I can only imagine. You just got out of the OR, you were saying. So
I
thank
did.
you. Thank you for making the time to speak with us for a few minutes.
My pleasure. My honor. Thank you.
Yeah. So tell me, what makes your mind bloom?
My mind bloom. It's a great question. So, and I think it's changed over the years,
Mm,
but lately what's making my mind bloom is the idea of integrating more holistic services into the treatment of my patients.
okay.
I really think that it's something that's been overlooked traditionally in medicine to integrate those types of treatments into the treatment of patients in general, but certainly for breast cancer patients, because that's what I treat.
Yeah.
It's becoming more and more apparent to me as I get deeper and deeper into my practice that those modalities are an absolute necessity in the treatment of this disease for women to be able to um, go from treatment to healing
Yeah.
seamlessly. So that's kind of been my passion right now, and my all of my brain children come from that.
Yeah, that's so interesting you mentioned that because yesterday I was talking with a breast cancer patient. She's in remission now, but she mentioned she was talking about the depression she fell
Mhm,
into very deeply after treatment, after surgery, after treatment. You know,
mhm.
you go through months of grueling therapy, and then you're left to your own resources, according
That's
to
it.
her. Yeah. So she is a big advocate for this not to happen anymore. And it's so interesting to hear you speak about that as well. So you do, from the medical community perspective, you do as well feel that there's a lack.
Absolutely. I think actually, if you watch the Evolve Pink video, I think that's an actual line that I say that these
Yeah.
women, even though the treatment is grueling and it's a grueling time in their life, they have a lot of support by way
Yeah.
of doctors, nurses, social workers, whoever it might be that's involved in their care. And when it comes to breast cancer, it's a multifactorial treatment.
Right.
And then, yeah, you come to the end of this treatment and you're kind of left hanging. Um, I always thought, like in the naivety of my training, that the day I told my patient, you're cancer free, you're at
Yeah.
the end of your care,
Yeah.
that would be a really, monumental moment that we
Yeah.
would hug, and it would be this big thing.
Yeah.
And really, what I was met with, and I realized very early on, it's that all of the worries that they have that have kind of subsided during their treatment are replaced in that moment with new ones. Like, well, what about tomorrow? What do you mean I'm going to see you in 6 months? Because these people have had a regimen of seeing doctors and nurses every couple of weeks, if not every day.
Yeah.
So that's the piece that I want Evolve Pink to fill, but not only fill, but to prepare women for that transition.
Oh, that is the best news.
Mhm.
Thank you for doing that. And what, so you speak of a holistic view of the patient. So what things would you recommend as self-care? What are the things Evolve Pink recommends?
So we recommend a lot of things, and it's an
Mm-hmm.
integration. So I know, and I like to make that really clear because sometimes patients seek me out thinking that that I treat breast cancer very differently, that I don't do surgery and radiation and chemotherapy. And that's not true. I believe in treating breast cancer with the things that I know work to get rid of it. However, that being said, the integration of those holistic modalities helps women throughout that grueling process to just heal better and to be able to go through that process in a much smoother and healthier way. So some of the things that Evolve Pink has been offering is meditations. We've done some yoga series. We're offering yin yoga weekly. We've launched an exercise program. We're offering a different exercise program a day. We're doing body circuit weightlifting, bar, different things. We're also focusing on nutrition. Um, I happen to be a pescatarian. I don't eat red meat. And there's not a lot of hard science, but I believe that reducing the consumption of meat is helpful for women in reducing the rate of recurrence in breast cancer. And it's good for you for other reasons also. So we host a Meatless Monday cooking seminar every first Monday of the month with our nutritionist, Nadia, who's wonderful. What else are we doing? We launched our preoperative Reiki program last night, actually, with our first patient. So we're going to be offering Reiki to our patients who are due for surgery. I perform surgeries on Thursdays. So Wednesday evenings, they'll go in, have a complimentary Reiki session the night before their surgery so that they're coming into that space in a calm, energetic way. What else are we doing?
You do
We're
makeup
offering
sessions.
Yes, we've done makeup sessions.
Ah,
We've done new moon ceremonies. We also host, aside from that, we host a lot of experts in their field to talk about some of the side effects that come along with breast cancer treatment. So we've had some experts come in to talk about pelvic floor issues, sexual dysfunction. We had a company called Bonafide, who I love their products. They're all natural, non-hormonal products that are used to treat vaginal dryness, to treat hot flashes, which is a huge issue for women going through breast cancer treatment, especially the younger women who are put into early menopause from their treatment. So we're trying to, keep our ear to the ground and listen to what women are experiencing and trying to bring the experts in that can help with those issues. And that's the goal, to educate, to empower, and to help women, even though this is, one of the more catastrophic things they'll probably face in their lives, to come out the other end not feeling, depressed and destitute, but with hope and with some new skills and things that they can incorporate into their lives.
And also a new community of other
Yeah.
women they can meet in the
Yes.
process. So who can join, who can benefit from Evolve Pink?
So anyone can benefit. A lot of what we're doing right now, which happened organically. So I'm glad that I named it Evolve Pink, because through this COVID crisis, it certainly has evolved. And right now, a lot of what we're doing, for better or worse, is virtual. And when this started, I was very disappointed about that, because we were about to lease a house and create our space, and everything turned virtual. But what I've learned is that our reach has become almost global. We're reaching women in Costa Rica, Australia. We were counting today with our grant writer. We've reached women in 41 different states. That blows my mind. And we just launched in March. So to me, it's just a testament of how needed this is in this community, to start integrating these things into this treatment. And to certainly create community for women who can meet women that are in similar situations to them.
That's beautiful. It's wonderful. I visited the website, and you offer so much. And then I became friends with a few of the people who contribute to Evolve Pink on Instagram. So it's a lovely community. Everyone wants to help, and everyone wants to support each other.
Oh, let me not forget. We did a hair loss series in August, which was wonderful. And we collaborated with several women in the breast cancer community to help guide women from before, during, and after treatment of chemotherapy to how to deal with their hair loss. And I had no idea how many things come up for women, during that. So for me, I'm learning a lot too.
Wow. And you never know what can happen. It's good to know all the parts of the process as women, and well, I guess as men too. Just a quick question, a quick curiosity I had. Are you seeing in your patients more women under 40 by any chance?
I'm seeing a lot of young women, to be honest. I really am. Not many under 40, a few, but certainly women in their 40s. And that's why, to me, one of the biggest points I make is that breast cancer screening needs to start at 40.
Mm-hmm.
If you have no increased risk, which we could talk about,
Yeah.
how to figure that out. And it needs to be yearly. It saves lives. When you look at the scientific data and the numbers, that's the age that saves the most lives. And there have been some groups that have come out and recommended that women start at 50 and every other year. But when I look at the numbers, I can't find a way to make that make sense to me. It needs to start at 40 and it needs to be every year.
Mine started earlier, yeah.
Yeah.